It's my pleasure to give an overview and introduction to Spotlight on Dry AMD. These are my disclosures. Some of the companies here work in this space. So we're all familiar with early to intermediate AMD, which by definition is dry AMD, and most of the patients with this condition are largely asymptomatic. As the disease progresses, they start to complain about needing more light to see things, but really not major symptoms. So these are patients that are at risk for going on to more advanced stages of the disease, as shown on the right. So we used to think about this dichotomously as patients going on to either wet or to developing center-involved geographic atrophy. But as we've been treating these wet patients for longer periods of time, we see that they too can also get geographic atrophy, and patients with GA can also get CNV. So it's really more of a spectrum of disease. Now we know that 1 in 3 patients over the age of 70 have some form of AMD, and 1 in 30 patients over the age of 75 have geographic atrophy, and this represents about 5 million people worldwide and 1 million people in the United States. So it's not surprising with those numbers that the current focus in dry AMD is on patients with more advanced disease with geographic atrophy, like we see in about 10 to 20% of patients with AMD, large areas of expanding central atrophy that results in permanent vision loss. And for the past many decades, we really had nothing to do for these patients. And now in early 2023, with Apellis' introduction of their C3 inhibitor pegcetacoplan, we now have FDA-approved drug for this condition to help slow down the rate of expanding GA leading to expanding vision loss. In addition, we anticipate within the next month or so of having a second drug from Iveric Bio with avacincaptad pegol with a similar mechanism of action in the same category of complement inhibition. But as we'll hear today, there are numerous other agents being explored for dry AMD and geographic atrophy. And so the type of benefit that we can see is shown here in the Oaks and Derby study with pegcetacoplan. I don't want to steal Cedric's thunder, but just to give a little bit of an overview here, we can see that there's clear evidence of a biological effect separating the monthly and every other month from the sham control in both studies. And in Gather 1 and Gather 2 with avacincaptad pegol, we see similar separation and evidence of a biological signal. The current focus, therefore, is on these diseases with these agents, and it's so exciting to, after all these decades, to finally have something in this space because it spurs innovation from other companies or even the same companies to come up with new innovations, perhaps even earlier in the disease process where we might see a more magnified effect downstream. That being said, even though we do see this distinct biological signal, it's perhaps a clinically modest benefit that we're experiencing. It's a difficult chair time conversation for physicians to have with patients. And they're like, oh, when am I going to start seeing better? Well, we had that conversation. It's not really going to improve your vision. It's going to slow down the rate of future vision loss. And so that is difficult. That being said, we are excited to have these new drugs available and imminently available. And, as with many new drugs, there can be safety concerns, but as the numbers get greater and as the manufacturing process gets optimized, I'm sure that we're going to see less issues with that over time. But it's not just complement inhibitors that gather our attention in this area. There's numerous other pipeline approaches to management of dry AMD and geographic atrophy, and these include neuroprotective agents, gene therapy approaches, as well as cell-based approaches, some of which we heard touched on this morning, in addition to antioxidant therapies. So as I mentioned earlier, it's really more of a continuum between wet AMD and dry AMD. It's not really two separate things. We just really have two different treatments for two different aspects of the disease. That being said, for patients with both who we feel may benefit from both, there are complicated and burdensome logistic issues with all of these injections and all of these visits, and this may represent an opportunity for for companies who have systemic approaches, such as Alexion, and some of the other companies that we're going to hear about today, as well as topical therapeutic approaches. So there's a lot of drug development considerations to consider. One of them is when to intervene. Although it's ideal perhaps to intervene early, it's difficult and expensive to study disease that's slowly progressive in the early stages. And so that's why we see a lot of these therapies for late stage disease. How to intervene? Is it to slow the progression, or is it more restorative like we heard about this morning? What are the outcome metrics? We're so used to functional metrics with wet AMD, but now we're coming to rely upon proxies for that, and that's definitely a big area of conversation. And then now we're seeing all these different routes of delivery: subcutaneous, oral agents, topical agents, injections, subretinal, surgical implantation of devices. And then there's also safety considerations, which has come to the fore. So fortunately, I just get to pose these questions. My colleagues that will follow on the panel on the spotlight presentations will get to try to answer a lot of these questions. And you can see the all-star cast of characters that we have here between all the different companies listed here: Iveric Bio, Apellis, Aviceda, Galimedics, and Lineage Cell Therapeutics. And then I'll join you again with Peter Kaiser moderating our expert panel discussion. So thank you for your attention, and let's turn it over to Dhaval Desai, who will present on behalf of Iveric Bio. Thank you.